Hello everyone, my name is Ryan Covey, and this is a presentation on the benefits of single-dose preoperative ibuprofen on patients receiving breast surgery, an educational module. So first we'll start off with the learning goals. From this quality improvement project, participants will be able to discuss ibuprofen, understand the complications of pain following breast surgery, identify the benefits of using ibuprofen over other analgesic agents, and develop analgesic-based protocols to treat breast surgery patients who are at increased risk for acute postoperative pain. The background of the problem. So patients are at an increased risk for acute postoperative pain when they're young, unmarried, and anxious. Uncontrolled pain is actually the #1 risk factor for chronic pain in patients undergoing breast surgery. A form of chronic pain after breast surgery is post-mastectomy pain syndrome. The incidence of PMPS is seen with decreased age. So 30 to 49 is 65%, 50 to 59 is 40%, and at 70 is only 26%. Currently, there's no gold standard for postoperative pain control for those patients undergoing breast surgery. So opioids have become kind of the mainstay and the popular drug of choice when dealing with pain for these patients. Acute and chronic pain, as we know, leads to a variety of different issues such as morbidity, decreased quality of life, decreased physical function, increased use of opioids, opioid addiction, and increased healthcare costs. The scope of the problem. So breast surgery pain is predominantly neuropathic. It involves basically damaged shoulder, axilla, and arm nerves. Of those who undergo breast surgery, 57% experience acute postoperative pain. That's a very large number. Of the patients that had undergone breast surgery in 2017, 10% continued to fill their opioid prescriptions 1 year after surgery. Thus, we think there may be an addictive component here. And NSAIDs such as ibuprofen have been found to reduce not only acute postoperative pain, but postoperative opioid consumption in multiple types of surgeries. Ibuprofen as a drug is an analgesic, obviously, and it can provide analgesia via its anti-inflammatory properties. The mechanism of action involves the inhibition of coxylinogase enzymes, also known as COX-1 and COX-2. These enzymes are responsible for pain signaling cascades and the synthesis of prostaglandins within the peripheral and central nervous system. And these prostaglandins activate certain receptors in the peripheral nervous system and at synapses in the spinal cord. Prostaglandins also activate ion channels leading to increased sensitivity of neurons. So not only do they activate the receptors responsible for pain, but they increase the pain throughout other portions of the tissue, also known as central sensitization. Inhibition of COX enzymes and prostaglandins therefore would lead to an increased analgesic effect. The benefits of ibuprofen: reduced pain scores for a variety of different surgical populations. These populations have included thyroidectomy, septorhinoplasty, and laparoscopic cholecystectomy. Several RCTs have found a reduction in fentanyl PCA consumption over a 24-hour period, and single-dose perioperative ibuprofen reduces acute pain the greatest within the first 12 to 24 hours, which is what we're looking at exactly, because that's the window where acute pain is highest. And then NSAIDs such as ibuprofen reduce the reoccurrence of breast cancer. There's actually some research going on that shows that this may be true. Basically, what we're trying to say here is that there actually is not a lot of research on breast surgery and ibuprofen use. The reason will be discussed later on. But so the research that's been done on ibuprofen has been done in a variety of different procedures, but actually not on breast surgery, or there's been very minimal research done on ibuprofen in breast surgery. So looking at these studies, we can kind of try to bridge that gap, that knowledge gap that we're having due to the lack of research. The benefits of ibuprofen continued here. When ibuprofen was compared with acetaminophen, ibuprofen provided superior analgesic effects and also reduced fentanyl consumption more. Due to ibuprofen's opioid-sparing effects, less opioid side effects occur, including nausea and vomiting. The side effect profile of ibuprofen, as long as it's used short-term, is usually quite minimal. And then NSAIDs do not cause either respiratory depression or neurological dysfunction, leading to increased postoperative recovery. So these patients aren't sedated or have decreased respiratory function, therefore they're able to get up more, they're able to recover faster, and able to go home quicker, which in turn, reduces morbidity, mortality, complications such as pneumonia, and long-term stay, and thus reducing cost. So ibuprofen versus gabapentin. Gabapentin has been a popular drug for postoperative pain, basically because it helps with the neuropathic pain that these patients feel. However, these effects are dose dependent, and as we increase the dose of gabapentin, we see increased side effects such as dizziness, nausea, vomiting, and sedation. The side effect profile for ibuprofen is extremely limited, as we said before, with short-term use, and one really good benefit is it has no addictive qualities, such as those with opioids. Patients can go home on NSAIDs safely, whereas medications such as opioids and gabapentin have addictive tendencies and decrease neurological function. So gabapentin less so on the addictive tendencies, but the neurological dysfunction, as you increase the dose of gabapentin, is seen. So why is there a hesitation to bring this into practice? So research is very limited as far as single-dose ibuprofen goes for patients undergoing breast surgery. As we said before, a major side effect is that NSAIDs may increase the risk of bleeding and hematoma in these patients. It's not very well understood if this is something that has actually been proven or not, and the research on this is actually quite inconclusive. In fact, many studies, many systematic reviews that I have found see that NSAIDs and hematoma development is actually not increased. And COX-2 inhibition, there is even some research out there that says it may reduce the risk of postoperative hematoma. This last point here is still very much in research. It's not been proven at all. Okay, so the take-home points here. Ibuprofen can reduce acute postoperative pain and opioid consumption for a variety of procedures. It has a very limited side effect profile with short-term use and is non-addictive. Its ability to reduce opioid consumption leads to less opioid-induced side effects. The non-selective COX inhibitor that ibuprofen is reduces or blocks enzymes that are responsible for pain signaling cascade and synthesis of prostaglandins within the peripheral and central nervous system. And the development of hematoma when using ibuprofen with breast surgery patients may be the factor that is limiting its use. However, this is yet to be proven, and as we just said before, is actually possibly the opposite, or there actually is no correlation between the use of ibuprofen and hematoma in breast surgery patients. That is all for this presentation. Thank you very much for listening, and have a great day.